A chin implant means adding an implant to your chin. And this can either be to change the shape of your chin, to make it more wide or more narrow, or to bring it out. In any case, you're adding more volume to the chin. So a lot of people come to me because they don't like their side profile, because their nose sticks out too far relative to their chin. And actually adding a chin implant will make their nose look smaller. A lot of people actually don't want their chin to look too wide, and so with each person I tailor the implant to the individual. There are a number of different materials to choose from, and I like a solid silicone implant because your body sort of hugs the implant really nicely, and if I ever need to take it out for any reason, it's much easier to come out than other materials such as MedPore or bone material. So what is the procedure like? Well, I do chin implants in the office all the time. After I numb up the chin using local anesthesia, I make an incision just inside the lower lip, and that gives me access to all the area of the chin. I make the pocket very tight because you don't want the implant to move around. And then once it's in there nice and snug, I use stitches to close the incision. For a week, you wear a wrap around your chin and head, and that gives support to the implant while it heals. And very minimal pain, just a little bit of soreness the first couple of days. So during the procedure, I'm working around two nerves that give sensation to the lower face called the mental nerves. And theoretically, those nerves can be damaged or stretched. Your chin will be numb for quite some time because those nerves do get stretched just by adding in the bulk of the implant. It will come back, so when it starts to come back, you'll feel the pins and needles like your hand is falling asleep and coming back. Another thing that usually happens is the muscle of the chin, called the mentalis muscle, gets really swollen, and it's actually a really thick, robust muscle. So it can make your chin look much bigger for a short amount of time, and sometimes that can perpetuate some anxiety, but nevertheless it will go down. And because this muscle is nice and swollen, it's not working as well either. So you can have some movement limitations to your lower lip, meaning you can have some asymmetries when you're smiling or talking, and the swelling can limit eating crunchy foods for a couple of days, but that gradually goes down. At about a month's time, you notice a lot of that swelling going down, and then it will keep getting better over the coming months.